Hi, I'm Dr. Gaurav Rastogi. I'm an orthopedic consultant in Manipal Hospitals Dwarka. So I'm an orthopedic surgeon. I deal with all the conditions pertaining to your bone and joints, including trauma and accidents. So fractures, shoulder pain, arthritis. So if you're having one of these, then I'm the guy. You're gonna come. Well, that's a very nice question, and the study has been done recently, and the findings actually correlate with my clinical practice here. Predominantly, most of the patients who are coming with shoulder pain, they belong to the middle-age group, and they are those, especially who are involved in working on laptops, working on mobile phones. Then those having abnormal postures like dentists, etc. One thing we have to understand is that the most common cause of shoulder pain is wrong posture, particularly this posture, right, in which we hunch forwards, and this is called as scapular protraction posture. So what happens is that our shoulder blades are supposed to be straight, right, and that's why we can maintain the balance in the front as well as in the back. But because of a wrong posture, because of working on a laptop or working on a cell phone, right, we assume this posture, and gradually the shoulder, they start coming forward, right. Because of that, the biomechanics, they alter. The muscles in the back, they will have to work a lot. They get stretched, and that is why they start hurting, and you experience pain in the shoulder. And the simple remedy is correcting your posture, and if you can correct that, then your pain will subside, right? And this is what happens, right? So I simply tell my patients just to sit properly. Frozen shoulder is a layman term, right? It simply means a shoulder that is stiff. It gets frozen, so you're not able to move your shoulder. Technically, there are many kinds of shoulder problems which can present as frozen shoulder. We generally classify them as primary frozen shoulder or secondary frozen shoulder. So if you get hurt in your shoulder, you don't move your shoulder will become stiff. So that is called a secondary frozen shoulder because it was secondary to something else, right? Primary frozen shoulder are unfortunately very common in India, and it is directly related with diabetes. So those patients who are diabetic, they have a high tendency to develop frozen shoulder. And as we know, India is the diabetes capital of the world. So that is why the incidence of frozen shoulder is very high. The management of frozen shoulder depends upon the underlying pathology, right? So if it is a primary frozen shoulder and it's because of diabetes, right, then we'll have to ensure that the blood sugars are controlled, right? And if the blood sugar are under control and the patient is taking his diabetes pills properly, then physiotherapy is the main answer to frozen shoulder. And if it is because of something else, like secondary frozen shoulder because of an injury, right, then again we have to deal with that first, right? If it's because of infection in the shoulders become stiff, you have to treat the infection. Most of the cases of frozen shoulder, they resolve with physiotherapy. However, there are 10% of patients will require something more aggressive than physiotherapy, and it will probably be an arthroscopic surgery. Now, the term arthroscopic surgery means a keyhole surgery, in which we insert a camera and we got some specialized instruments and we literally open up the shoulder. And but even after opening up the shoulder, you have to move your shoulder. If you don't move your shoulder, then again it will become stiff. Well, hip arthritis is actually more a problem of West. In India and in especially Asian countries, we have a habit of squatting, and squatting is actually good for hips. So that is why when we ask your kid to squat in the toilet or something like that, right, it's actually good. You're helping the hip out. But if somebody is unfortunate enough to develop hip arthritis, there are broadly two types of hip arthritis. One are inflammatory hip arthritis, and one is non-inflammatory hip arthritis. Inflammatory hip arthritis means because of some underlying condition. So those people who have rheumatoid arthritis, they have a tendency to develop hip arthritis. Those who are having condition like ankylosing spondylitis may also develop secondary hip arthritis. Besides those who consume a lot of alcohol or those who have some liver problems, they have a tendency to develop something called as AVN, that is avascular necrosis, and there's the blood supply to your hip, it pops out, right, and your hip simply dies out and you ultimately develop hip arthritis. The other causes, non-inflammatory hip arthritis, is more common than inflammatory. Non-inflammatory simply means because of aging, wear and tear. That is the most common cause of hip arthritis. The other cause can be because of fracture, right, which is increasingly becoming common as the general population started aging, right, and so the management of hip arthritis depends upon at what time have you presented to the doctor. If you presented early and the hip is not grossly damaged, then what it requires just is medicines plus physiotherapy. But if you are presenting in advanced stages, which normally happens in my clinical practice, that people simply limp and enter my clinic, right? At that time, you get an X-ray, the hip is grossly damaged. The only option we have is hip replacement. Now, the good news about hip replacement is that there was a study conducted by WHO, and they found that of all the surgeries conducted in all parts of the body, be it cataract surgery, be it heart surgery, hip replacement has the most predictable outcomes. It has got 98% of people are satisfied after the hip replacement. Newer things are coming up for hip pain, and the good news is that most of people are presenting early. The general awareness about one's own health has increased. So we do have a lot of young people coming to us, coming to me, and especially they were doing some power yoga in the gym, and then they started having pain in the hip, or they notice a pain after driving long distance, right? And when you assess them, the newest thing which is entering the market is hip arthroscopy. Now, hip arthroscopy means introducing camera into your hip and visualizing what is wrong and addressing if there's anything wrong. Right. Arthroscopy was till now predominantly a domain of knee and shoulder surgeons. You would have heard about keyhole surgery of the knee, keyhole surgery of the shoulder. Right. But hip arthroscopy is coming up now. People, orthopedic surgeons are developing skill sets for that. And a lot of problem can be addressed by simple keyhole surgeries like your labrum tears, something called as FAI, which can be done arthroscopically, and you need not have a major big surgery for that. Arthroscopy surgery means that the blood loss is less, rehabilitation is faster, and people can go back to their normal life very, very soon. Well, it's a common myth that there's this term called a shoulder separation, right? But honestly speaking, there is no such thing as called as shoulder separation, right? Shoulder dislocation is in vogue, and it's a known entity when your shoulder, which is actually a ball and socket joint, so the ball pops out of the socket, and that is what is called as dislocation. Some people confuse fractures with separation. They say that, oh, my shoulder got dislocated and it also got fractured, so my shoulder got separated, but there's nothing like that. But dysplasia as a word means wrong formation. So that is what Latin meaning of dysplasia is. Hip dysplasia means that hip has been formed incorrectly. So either the ball has been malformed or the socket, or which we call as acetabulum, is malformed. Now, hip dysplasia is a very common entity. The reported incidence in India is around 1:10,000. Now, when we hear 1:10,000 means 1 in every 10,000 per baby that's being born can have a dysplastic hip. To us, it might sound, oh, it's a rare entity, but when we understand the fact that there are more than 1 million deliveries occurring in India every day or every week, right? So that means that we are having at least 1,000 babies with dysplastic hips every week in this country. Dysplasia being malformed, so the hip gets malformed when the baby is inside your womb or when the baby is coming out. It's also called as developmental dysplasia of hip. That is the most common form of hip dysplasia. The treatment of it depends upon how quickly you pick it up. Most of the countries now, including India, have screening programs where when your baby is born, an orthopedic surgeon or your pediatrician will check your baby if the hip is fine or not, right? If they feel that the hip is not fine, they may refer this thing to a specialist. And if it's dislocated, right, then you can simply put it back in the socket, apply plaster, and the baby becomes okay. The problem comes when this diagnosis gets delayed, right? Unfortunately, it happens quite frequently that people notice something wrong in the hip only when the kid starts walking. That means by the time the baby is around 12 to 15 months old, at that time, we've missed the golden hour. So a lot of these cases we cannot treat by simply putting them back to the socket and by applying a plaster. At that time, you will require some surgeries and a lot of surgeries for that. Again, the earlier you pick it up, the better it is. So surgeries which are done when the child is 12 months old or 18 months old, they have got better outcomes as compared to surgery that is done when the child is 5 years old, right? And this actually happens that people might simply present once their skeletal growth is over. That means by age of 16 years or 18 years. If that happens, the hip is already destroyed. You cannot do anything to save it, and then the last resort would be a total hip replacement. These are the different treatment strategies for hip dysplasia. Well, knee osteoarthritis, surprisingly, is the most common geriatric problem. A study says that 70% of people more than 70 years of age will have osteoarthritis, and almost 100% of people beyond 80 years of age will have arthritic knees. And that is why you can easily relate to what I'm saying, that at least one member of your family would be having bad knees, would be having pain in the knee, walking with deformed knees, and so that's quite common. Now, the good news is that it cannot be avoided, but yes, it can be slowed down, and the key to that is exercises. Well, I can use a knee model to explain this thing further. Now, this is a knee model where this is the bone above, which is called as femur, this is the bone below, which is called as tibia, and you have a big muscle which you use when you stand, which is called as quadriceps. Now, this quadriceps inserts onto a bone called as patella or kneecap, and then that forms one of the strongest ligaments of your body, which attaches to the bone, strongest tendons of your body, which attaches onto the tibia. Now, the health of your knee relies on the health of this muscle. If this muscle is healthy, it will lift up the kneecap when you're walking or when you are moving your knee, and so you don't have any friction between the bone and you do not damage your knee. If this muscle is unhealthy, and that's what happens when people age, right? The exertion levels go down, exercise levels go down, right? So this muscle loses its tone, and there are higher contact pressures between the kneecap and this bone below, which causes gradual damage to the cartilage. Also, there's a big muscle here, which is again a part of quadriceps, which atrophies the earliest. That is called as VMO. So that is why predominantly arthritis starts from the kneecap and then starts involving this part, the inner aspect of your knee. So if you exercise regularly, if you keep this muscle healthy, then you can slow down your knee arthritis. One very common misconception regarding knee arthritis in India is that if you're having bad knees, then stop walking. Well, you're going to damage your knee further by stopping walking. Right? So you need to continue your walk, right? And it will actually help your knee instead of damaging it. Well, it depends upon what is the source of knee pain, what is the cause of knee pain, right? If the knee pain is because of an injury, that you just sprained your knee or you tripped over something, then ice application is the remedy. So apply lots of ice, use a compression bandage, which we normally call as crepe bandage or garam patti in the local language, right? And that's it. So there's an acronym for that is called as RICE. So rest, ice, compression, elevation. Just do that and the knee pain will subside. But if the knee pain is because of arthritis and you're having it, then first thing you need to walk. That is important.
Secondly, you have to avoid those positions in which your knee is under maximum pressure, and normally that is a squatting position. So when you sit down and you squat, right, that is when there is a lot of pressure on your knee, and getting up becomes a big challenge. So if you avoid squatting, you will avoid having pain. Precaution is better than cure, right? The most common reason why people squat here in India is because of the toilet, right? So those who are using Indian commode, they will need to squat for their daily activities, and they will at least be squatting once or twice in a day. So a simple solution would be to change your toilet, right? If you start experiencing knee pain, switch over to Western commode. Otherwise, if suddenly, surprisingly, you were sitting in somewhere, and when you got up and you start having pain in your knee, the best solution at that time would be just to apply ice and a local ointment, right? And if the knee pain continues for more than 2 or 3 days, then go and visit your orthopedic surgeon. Well, this is actually a mystery to most of the people, and there are a lot of people who walk into my clinic saying that I didn't fall, I didn't trip over anything, and this knee is hurting like anything, right? And the pain has been there for the past 1 week only, and before that I was absolutely healthy. Well, it's again the things they build up, right? So pain just presents like a tip of the iceberg, right? So if you're having weak muscles, and if you're sitting in a wrong position, like sitting cross-legged for quite a long time, as if you are in a kirtan or in a ceremony which involves sitting cross-legged, then suddenly when you unfold your knee and you try to get up, right, your kneecap does not move properly. It gets jammed and you experience a lot of pain, right? That is the most common cause. Sometimes there are structures inside the knee. I'll again use a model to explain further. Now these are structures inside the knee, these little ball bearings type thing, which are called as meniscus. Now sometimes you do have degenerative tears of the meniscus, and if you are in a wrong position, then these tears may get locked inside your knee joint, right? So these are again a cause of pain. Sometimes it also happens that you are sitting and you're doing a squat, and suddenly when you get up, you hear a pop in your knee, and then it starts hurting vigorously. So if that kind of thing has happened, that means you have ruptured one of the roots of these meniscus. Okay, and again you'll need to seek a medical attention for that. So these are the few common causes of knee pain without any injury.